This week on the Steel Report.
For some, they keep it inside, and it's years later where they finally realize that their life could be better if they just had someone that they could work with.
Ongoing help for victims of sexual and domestic violence through the Riverview Center. Plus,
it started off as a hobby, and as I kept collecting them, it became more of an obsession.
An obsession of collecting old books, including one from 1485. And our program begins right now.
Now from KWWL, this is the Steel Report.
And right now on the Steel Report, I want to welcome back to the program. This is the Executive Director of the Riverview Center. This is Gwen Bramlett-Hecker. And Gwen, you were last on the program just about a year ago, as a matter of fact. It was back on, believe it or not, episode 529, back on January 28th. And we were talking about the work that you do with the Riverview Center. Why don't you talk a little bit about some of your offices and what you do as your mission to help assault survivors?
Thanks, Ron. So we at the Riverview Center provide crisis and long-term support services for survivors of sexual violence in 14 counties here in Iowa, as well as 2 counties in Illinois. And then for survivors of domestic violence in our 2 counties in Illinois, Joe Davies and Carroll. Here in Iowa, we have our offices in Cedar Rapids, in Decorah, here in Waterloo, and in Dubuque. We also serve the UNI campus, and we serve up in Alameda County, working with Spanish-speaking population there as well. Our services start from the moment someone decides to disclose that they've experienced some type of violence. That might be at the hospital, it might be at law enforcement, or it might be on our hotline, our 24/7, 365 hotline. And our work then with survivors continues for as long as they want to work with us. We have survivors that we meet with to help through initial court processing or through sort of their initial processing of the trauma, all the way through advocacy, general advocacy, medical advocacy, therapy services, as well as we do prevention services as well in the communities. We work with school districts and community partners to spread our vision, which is a world free of violence.
Absolutely. And some of these things may happen immediately. They may call your hotline immediately. Some they might wait a few months or maybe even years.
Yes.
Right?
Yeah. We worked with survivors as old as, in their 70s who experienced childhood sexual abuse and carried it with them for decades. And finally, most of the time it hits them that the challenges that they've experienced in their life, sometimes it's with challenges with having healthy relationships or difficulties connecting with their children or challenges with keeping a job. Oftentimes they have identified that it relates back to the abuse they experienced as children. So they call us, they come to us, and even if there's not a court case or anything involved, we work with them to help process that trauma and find life can be good after healing.
Yeah. And that's the thing I think most people don't realize. Probably the sooner they contact you, the better, because this lingers, and a sexual assault victim may not even realize the impact that this has had and is having and will have on their life.
I was thinking about this today. Most of us have experienced, unfortunately, an auto accident, and it's a very traumatizing experience. But if you asked each one of us to explain how that trauma impacted us, it'd be different. And it's the same with someone who's experienced sexual assault or domestic violence. For some, the impact is acute and immediate, and they need immediate crisis response assistance. For some, they keep it inside, and it's years later where they finally realize that their life could be better if they just had someone that they could work with and support them through processing and facing what can sometimes be difficult to face.
So you mentioned the confidential hotline, a crisis line. You have your sexual assault crisis line that you can call 24 hours a day. Someone's going to pick that up.
Yes.
What is the main reason people refuse or are just really hesitant to go forward with reporting this, with telling someone?
The number one reason is because they think that people won't believe them. And that is our number one value, organizational value, is we just believe survivors. And when I work with staff or I'm hiring new staff, I'll say to them, we just believe survivors. Can you do that? And people will say, yes, absolutely. Even myself, when I joined Riverview Center almost 8 years ago now, I thought, I can do that. We are so programmed in rape culture and a culture of violence that we live in to always sort of question whether or not someone's telling the truth. And a therapist who works for us once said to me, Gwen, the reason why people find it so hard to believe what survivors tell us is because sometimes what survivors go through is just unbelievable. And so that's the number one reason people often don't come forward, is they really believe no one's going to believe their story. And so when we work within the systems, the criminal justice system, or work with the social service system, the mental health system, we try to help people in a trauma-informed way really get to a place where you just believe what a survivor tells you, and that's the first step in their healing journey.
So let me ask you this. You received a pretty sizable grant recently. I believe you mentioned $700,000.
Yeah.
Tell us where that came from. What will you do with that money?
Sure. And since I was here and talked about that grant, we actually have received another large grant, which I'll mention. The first grant, the $700,000 grant, was a grant specifically from the Office of Violence Against Women, the federal office, to focus on services in rural communities. The challenges that survivors have in rural communities are unique to those that maybe someone would experience in Cedar Rapids, for example, here in Waterloo. In rural communities, there's so few services available to support them. And also, everybody knows each other. So when you go to disclose to a law enforcement officer or to a nurse at a hospital, they might be your next door neighbor. They might be, they might be your family member, right? And so for us, the $700,000 grant was really about us digging into our rural communities and being a support for them to address their unique barriers. The grant we just received, also from the Office of Violence Against Women, is a transitional housing grant. We know that for survivors of domestic violence and sexual assault, oftentimes housing, it's difficult for everybody, but it's really difficult for those who have experienced trauma, the trying to create a stability in their lives. And so this new transitional housing program or transitional housing grant that we've just received, we're not off the ground with it yet. It'll be after the first of the year that we'll actually be implementing it, but it will help survivors find stable housing.
Now, do you work with other organizations, for example, like Friends of the Family? I mean, they have a safe kind of, I guess I could call it a safe house, maybe, where people can go, shelter it so they can get away from the abuser right away.
Right.
Do you have something like that too, or you work with these other agencies to make that happen?
Absolutely. So, one of the things that's really important, particularly when you're a grant-funded agency or you're heavily funded by grants, is to make sure there's not a redundancy of services. So we absolutely do partner with Friends of the Family, for example, to use their shelter. Although they too, we've just recently been talking with them about, we know that for somebody who's experienced trauma, living in a shelter is really not a great place. So they too work very hard to find places outside the shelter. So we work with them. We work with Waypoint, which is our sister agency here in Iowa that works with survivors of domestic violence down north, and family services, helping services, which works with survivors of domestic violence up in our northern regions. So we do work, and we work with Amani, who works here with survivors from people of color who are survivors, and Monsoon, who works with people who are survivors from the Asian Pacific region. So we do partner a lot with these agencies to try to find the best sources of support for survivors that are unique. And I think that's the biggest thing that people need to take away is everybody who experiences this trauma, their needs are very unique and must be addressed individually.
Exactly. Well, it's great to hear that you're all working kind of together on the same wavelength. You're always, though, in need of volunteers, aren't you? So is there a way that a person watching this say, that might be something I could really help? Maybe I was a survivor myself or assault victim. Maybe I could help someone along that line.
Absolutely. A lot of people who come to this work, staff members as well as volunteers, come because they've experienced something in their life and they want to give back. We absolutely at Riverview Center are in need of volunteers across our service area. And there's many, many ways that you can volunteer. The most impactful probably is the volunteers that we have that do respond to the hospitals in the middle of the night, on the weekends, to support survivors who are disclosing a recent assault, or who man our hotlines in our Illinois area, Illinois counties, who might have experienced domestic violence. We are a 24/7, 365 agency, so if we don't have volunteers assisting us, it's our small but mighty staff who man 24/7, 365 the hotlines and crisis response. So having volunteers do that, go through the training and do that is just such a gift to us. But there's many other ways they can help us. We do a lot of tabling and awareness building events, so they can help us man tables at schools or at other community partners, health fairs or whatnot, to help us spread the word about the work we do. They can come to the office and just help us answer the phone. Sometimes it's ringing off the hook, and it's nice to have somebody that can at least just answer the phone and shuffle the calls where they need to go. And we also need help with our fundraising events. You know, we always need as many hands as possible when we're doing fundraising events.
And you have your annual appeal. I assume it's underway or getting underway.
It is underway, as
Yeah.
is a lot of appeals, with today being Giving Tuesday, when we're filming this. And you know, a lot of my friends who run amazing nonprofits in this area also have their appeals going on. And you know, I certainly know that money is dear to everybody right now. It's Christmas time. It's a difficult economy right now for some. But I want to make sure that people understand a gift to Riverview Center, you know, a few dollars that you can spare to Riverview Center, it comes to us in a way that we call unrestricted. And what that means is those are dollars that we can use in an agile way to address specific needs of specific survivors. So if there's a survivor that's struggling to get to work because their car is broken down, they can't get their kids to school, you know, $200 might fix a car, which can change that person's life. And it's amazing how people can really overcome trauma and really thrive if they just have the means of taking care of themselves and their family, right? So any gift that comes to us right now, our appeal is, our theme is change the future. And we mean by that, change the future for survivors. It might be 5 minutes from now is when a survivor is focused on what are they going to do next. It could be 5 weeks from now, 5 months, even 5 years from now. So a gift to us during this time, during our appeal, can really help us change the future for survivors in ways that are impactful for each individual survivor.
And I want to ask you about your main fundraising event is always in April. Why don't you talk about that?
Yeah.
I assume it's coming up again here.
It will be April is Sexual Assault Awareness Month, and so that's always when we host our Evening of Light series is what we call, and we do them a little bit differently every year. Our big event is always on a Thursday night in Dubuque, where we always have our big, and Dubuque is always responds so lovely and is so supportive of us. We also will likely have Breakfast of Light events in some of our other communities in April. You can stay tuned for those announcements when we get it all set. I've been working on that now. It's amazing how early you have to.
We'll let everybody know about that.
We will absolutely let everybody know about that.
Gwen, I really appreciate the work that you do. It's absolutely vital for so many people and the hundreds and thousands of people that you probably helped over the years.
Yeah.
It's just incredible. So keep up the work, and hopefully people will respond to your appeal and also your call for volunteers. So
awesome. Thanks,
appreciate
Ron.
that. Okay, more on the Steel Report coming up right here in just a moment.